sorry. The first part of the sensory system is the receptors, organ of the or cell of the nervous system, which receives the stimulus and respond to the stimulus. These are called the receptors. If you see the basically structure of the receptors, they are similar like that of the transducer. So what transducer does, it converts the one form of the energy into the another form of the energy. Similarly, these receptors change the one form of the energy into another form of the energy, and depending upon the what type of the energy they received, and they convert it into electrical impulse, or they convert it into action potential. What receptor does, it receives the energy in the one form and convert it into action potential, and depending upon what type of the energy involved, these receptors can be classified. Receptor which respond to mechanical energy is called mechanoreceptors, and that what like a pressure, touch, and these receptor stretch, these type of the forces will convert into electrical impulse or action potential and goes to the central nervous system. Receptors will respond to the thermal energy are called thermoreceptors, heat and cold receptors. So they respond to the change in the thermal energy and convert it into action potential and send it to the brain. Then receptors which respond to the chemical energy are called chemoreceptors, like chemoreceptor present in the carotid sinuses, or taste receptor, or olfactory receptors, or even pain receptors. They respond to the change in the chemicals, and that chemical energy will convert into action potential. The receptors will respond to the light are called photoreceptors, or like a rods and cones present in our body, and they utilize the light energy and convert it into electrical impulses. The receptors will respond to the sound waves, or auditory receptors, like they respond to change sound waves and convert it into electrical impulses. So there are like a different type of the receptors present in our body, and they convert that energy into the electrical impulses. An action potential will develop in the first node of the ranula in receptor cells, and from there it carries to the sensory ganglia. Okay, so
सर
from
सर
yes,
सर एक्शन पोटेंशियल होता क्या है?
तुम्हारा एक्शन पोटेंशियल हुआ नहीं है अब तक?
नहीं सर, मुझे क्लियर नहीं.
एक्शन पोटेंशियल ऑफ सेल मेम्ब्रेन सर.
हाँ,
तो सर इसमें जब हम किसी सेल मेम्ब्रेन को डिस्टर्ब कर ले, मतलब फ्लो ऑफ चार्जेस,
बोलो बोलो.
फ्लो ऑफ चार्जेस लाइक सोडियम इंटर होता है, पोटेशियम
हाँ
बाहर चला जाता है, तो
हाँ
इसकी वजह से मतलब सेल मेम्ब्रेन बिकम डिपोलराइज होती है.
हाँ.
ये सर, तो सेल मेम्ब्रेन पर मतलब एक्शन पोटेंशियल आता है ड्यू टू थ्रेशोल्ड स्टिमुलस. ये सर.
ओके, अभी जिसने सवाल पूछा था उसने जवाब दिया कि किसी और ने जवाब दिया?
नहीं, किसी और ने दिया सर.
ओके, ठीक है. चलो अभी फर्स्ट वी विल अंडरस्टैंड द एक्शन पोटेंशियल. Now, what happens whenever we apply a threshold stimulus to any excitable tissue? Here, excitable tissue is nerve. और अभी रिसेप्टर में हम जाएंगे तो here we consider receptor as a excitable tissue. हम threshold stimulus अगर रिसेप्टर पे डालते हैं, suppose this is a प्लीज जिसका भी माइक ऑन है प्लीज ऑफ कर दो. So this is one of the receptors passing in corpuscles, and it responds to the touch. Now consider this is a receptor, and now what will happen? I will apply pressure here. यहाँ पे हमने प्रेशर अप्लाई किया. ओके, प्रेशर अप्लाई करेंगे तो क्या होगा? इट डिस्टॉर्ट द साइज शेप ऑफ द दिस पैसिनियन कार्पसल्स. इसमें एक जिलेटिनस मटेरियल होता है, and it distort a force हर जगह पे अप्लाई होता है, and that will open the sodium channels here. यहाँ पे सोडियम चैनल्स ओपन करता है, सो इट इंक्रीजेस द परमेबिलिटी ऑफ द सोडियम. जब भी आप कहीं प्रेशर लगाओगे, फ्लूइड मूव होगा, और दैट मोमेंट ऑफ द फ्लूइड will open sodium channels and sodium ion will start entering into the cells. Now consider this is a membrane potential and उसका normally now उसका resting membrane potential होता है -70 millivolt. जैसे pressure मैंने apply किया that will open sodium channels and this will start increase positive ion inside the cell and that will start raising the membrane potential and it will start going higher and higher from -670 it start maybe go to -65 or it maybe go to -60. So whenever I apply pressure, it will make changes in the Pacinian corpuscles, change in the membrane permeability, and that will raise the membrane potential. And this raising in the membrane potential is called as a receptor potential. Here it is not resting potential. This is called receptor potential. जैसे synaptic potential होता है, motor and plate potential होता है. This is similar like receptor potential. And this can summate. Add on हो सकता है and it can also transfer from one point to other point, but जैसे जैसे दूर जाएगा उसका intensity कम होता जाएगा. But suppose I apply a strong stimulus that is strong enough to raise this membrane potential from -70 and it can goes up to -55. इतने सोडियम चैनल्स ओपन हो जाते हैं. These are mechanical sensitive sodium channels. This opens and that can goes up to -55 millivolt. If it goes to the -55 millivolt, it will open another set of the sodium channels that is called voltage gated sodium channels. And now these all sodium channels which are present here almost near the first node of the ranvier. यहाँ पे सपोज माइलिन है तो फर्स्ट नोड ऑफ ranvier है. वहाँ पे जितने भी वोल्टेज गेटेड सोडियम चैनल्स है क्योंकि यहाँ से यहाँ तक मेम्ब्रेन पोटेंशियल ट्रांसफर होता है एज अ रेस्टिंग पोटेंशियल. एंड जितने भी वोल्टेज गेटेड सोडियम चैनल्स यहाँ पे दैट विल ओपन and now it will increase permeability of the membrane very high for the sodium and there is a यहाँ तक तो slow जाएगा and then there is a rapid increase in the there is a rapid increase in a membrane potential, so that is upward. So -70 से वो 0 की तरफ जा रहा. तो पहले जो पोल हो रहा था पोलराइज हो रहा था, एक तरफ 0 एक तरफ -70. नाउ दे आर कमिंग क्लोज. सो दिस मैकेनिज्म इज कॉल्ड डीपोलराइजेशन. सो जो दो पोल पे मेम्ब्रेन पोटेंशियल था अभी वो ऑलमोस्ट न्यूट्रल 0 के आसपास जा रहा है. सो इट गोज अप टू 0 एंड ऑल्सो गोज बियॉन्ड दैट. Can goes up to +30 +40. So this mechanism is called depolarization. लेकिन जैसे सोडियम वोल्टेज गेटेड सोडियम चैनल्स ओपन होते they are very fast and very fastly get inactivated also. So they once they cross 0 up to that time will start becoming inactive and now there is no more entry of the sodium. But that is simultaneously after membrane potential goes above -30 it will start opening the potassium ion voltage gated potassium channels and now that increase the permeability for the potassium ion. अभी क्या होता है सोडियम आयन नॉर्मली आउटसाइड में बहुत ज्यादा होता है इनसाइड में कम होता है इसलिए सोडियम आयन बाहर से अंदर आया है. बट पोटेशियम आयन अंदर सेल के अंदर ज्यादा होता है और एक्स्ट्रा सेलुलर फ्लूइड में बहुत कम होता है. तो जब पोटेशियम आयन के लिए परमेबिलिटी होती है तो अभी अपोजिट डायरेक्शन में मूव होगा और पोटेशियम अंदर से बाहर जाएगा. अभी पॉजिटिव आयंस बाहर जा रहे हैं तो दैट मेम्ब्रेन पोटेंशियल स्टार्ट गोइंग डाउन. Slowly it will goes down and it can goes up to resting level. And this is called पहले depolarize हो गया और फिर से membrane potential are moving away. So again it getting polarization. That is called repolarization. So पहले depolarization then repolarization. And potassium channel थोड़े slow होते हैं as compared to sodium channel. So once you start closing, they'll remain open even after you reach to the resting membrane potential. So membrane potential goes little below than the resting membrane potential and comes somewhere around -72 millivolt. And this is called after hyperpolarization. So the phase of firing level, depolarization, overshoot, and repolarization, this together is called action potential. अपने बॉडी में कोई भी इम्पल्स कैसे कंडक्ट करनी है नर्व से, इट इज ऑलवेज कंडक्टेड थ्रू द एक्शन पोटेंशियल. रिसेप्टर पोटेंशियल और इलेक्ट्रोटोनिक पोटेंशियल मोटर एंड प्लेट नहीं कंडक्ट होगी, थोड़ी दूरी जाएगी. बट एक्शन पोटेंशियल कैन ट्रेवल थ्रू आउट द बॉडी लाइक इलेक्ट्रिक करंट जो अपने घरों में बहता है. इन सेम वे इट कैन ट्रेवल टू एनी distance without decreasing its intensity. That is what action potential. समझ में आ रहा है?
जी जी सर, ये जो वोल्टेज गेटेड सोडियम चैनल जब खुलेंगे तो उसी लम्हे पे वोल्टेज गेटेड जो पोटाशियम चैनल है खुलेंगे या थोड़ी देर बाद
थोड़ी
खुलेंगे?
देर के बाद -55 पे सोडियम चैनल खुल रहा है, -40 टू -30 के इसमें पोटेशियम चैनल खुलेगा, बट सोडियम चैनल बहुत फास्ट होते हैं तो दे ओपन वेरी इमीडिएटली.
जी सर।
पोटेशियम चैनल थोड़े स्लो होते हैं, इट विल टेक लिटिल बिट टाइम टू ओपन. सिमिलरली इट विल टेक लिटिल बिट मोर टाइम टू क्लोज.
नहीं सर, मैं कह रहा हूँ कि जब डीपोलराइजेशन होती है
हाँ.
तो वोल्टेज गेटेड चैनल पहले आयन चैनल्स खुलते हैं, उसके बाद वोल्टेज गेटेड सोडियम चैनल्स खुलते हैं. तो डीपोलराइजेशन होगी जब मसलन वोल्टेज गेटेड सोडियम चैनल्स खुल रहे होते हैं, उसी लम्हे वो वोल्टेज गेटेड पोटाशियम चैनल्स खुलते हैं या थोड़ी देर बाद?
थोड़ी देर के बाद, मतलब
जी
-55 मिलीवोल्ट पे सोडियम चैनल्स खुलते हैं और
जी सर।
-30 पे पोटेशियम चैनल्स खुलते हैं. तो
जी सर।
-55 हो गया, -30 समवेयर यहाँ पे आ गया. तो जब आपका मेमोरी पोटेंशियल -30 तक पहुंचेगा तब पोटेशियम चैनल्स खुलना चालू होंगे. बट ये
जी
पोटेशियम चैनल्स पूरे तब खुलते हैं जब ये 0 के ऊपर चल जाते हैं, क्योंकि थोड़ा टाइम लेते हैं खुलने के लिए.
जी सर। यहाँ पे जो -55 मिली वोल्ट होगा ये हमारा थ्रेशोल्ड पोटेंशियल होगा
हाँ,
या?
फायरिंग लेवल, वी कॉल इट एज अ फायरिंग लेवल. -55 मिलीवोल्ट के लिए वोल्टेज गेटेड सोडियम चैनल सेंसिटिव होते हैं. जब भी आपका मेम्ब्रेन पोटेंशियल -55 मिलीवोल्ट पहुंचेगा, दिस वोल्टेज गेटेड सोडियम चैनल्स विल ओपन.
जी जी सर, थैंक यू।
सर ये पोटाशियम चैनल जब ओपन हो जाते हैं सर, ये रिपोलराइजेशन के लिए ओपन हो जाएगी?
हाँ,
मतलब
रिपोलराइजेशन, पोटेशियम बाहर जाएगा, सोडियम अंदर आता है तो
जी
पोटेशियम
सर,
बाहर जाता है. तो पोटेशियम
मतलब सेल
मेम्ब्रेन
मेम्ब्रेन पर रिपोलराइजेशन आएगी?
हाँ,
सेल मेम्ब्रेन पर सर फिर मतलब रिपोलराइजेशन आएगी, थर्मोस्टेट?
पहले डीपोलराइजेशन फिर रिपोलराइजेशन.
यस सर, यस सर, यस सर, थैंक यू।
और किसी को कुछ पूछना है इसमें?
सर
हाँ बेटा,
सर स्किन में कौन से टाइप्स के रिसेप्टर्स होते हैं?
बात कौन कर रहा है, नाम बताओ.
जी सर, मोहम्मद अली, ग्रुप 4।
Okay. हाँ बोलो अब.
सर स्किन में कौन से टाइप्स के रिसेप्टर्स होते हैं?
स्किन में टच रिसेप्टर होता है, पेन रिसेप्टर्स होता है, थर्मल रिसेप्टर होता है, प्रेशर रिसेप्टर होते हैं, वाइब्रेशन रिसेप्टर्स होते हैं, प्रोप्रोसेप्टर रिसेप्टर्स होते हैं, हेयर
सर
सेल
थैंक यू।
रिसेप्टर्स होते हैं.
सर हेयर सेल्स कौन से होते हैं?
हेयर सेल के एंड में होते हैं. तो जब भी आपके हेयर्स मूव होते हैं ना, दैट हेयर सेल
जी जी।
रिसेप्टर्स गेट स्टिमुलेटेड, दैट विल गिव्स यू फीलिंग ऑफ द टच. जैसे आपके
यस
बालों को छूते हैं, दिस हेयर्स आर डेड, but still someone touch your hair, you will feel someone is touching your hair.
यस सर।
It is because of receptor present at the root of the hair cells. और जब भी हेयर की थोड़ी भी मूवमेंट होगी, this receptor gets stimulated.
यस सर, थैंक यू।
Sir, transduction of receptors.
Conversion of the one, ऐसे जैसे इधर बताया मैंने, मैकेनिकल एनर्जी है, that converted into action potential. That is what we call
Yes,
it
sir.
transduction.
So mechanical receptors are transduction receptors.
All receptors are transistor receptors. They transfer one form of the energy into action potential.
Sir, proprioceptors
सर ये
are also
Sorry?
proprioceptors, muscle
Proprioceptor
receptor.
receptors are all, they are also transducing receptors.
सर
Okay, sir.
Okay?
Yes, sir.
सर
So,
ये रफीनी एंडिंग्स, मर्कल डिस्क वगैरह, सर ये क्या चीज है?
these are also different type of the touch receptors. Free nerve ending is a receptor for the pain sensation.
सॉरी सर, आई
All these are different type of the receptor. Marcus Corpuscles जो बोल रहे हो touch receptor के लिए use होते हैं, while free nerve ending is used for pain receptors or pain sensations. They are also called as the nociceptors.
Yes, sir.
और कुछ?
Auditory sensation.
Yeah, these are hair cells which stimulated whenever these vibrations occur at the cochlear membrane. These hair cells move, and that will causes a action potential.
So in which part of brain auditory sensation?
It goes to temporal lobe, auditory cortex.
Auditory
सर
cortex.
ऑडिटरी नर्व भी वहीं पे एंड होती है
Sorry?
Sir,
सर ऑडिटरी
सर
नर्व अराइज भी वहीं से होती है
हाँ.
यस
sir, and sir, go out through brainstem or that?
सर
सेंसेशन
through
ब्रेन के अंदर
out
जाते हैं,
through
ब्रेन से बाहर नहीं जाते.
Yes, sir.
yes
So
in पूछो
बताओ मुझे. अब एक्चुअली समझ में नहीं आता कौन बात कर रहा है. बताओ अभी.
yes, sir. So I ask, auditory nerve is temporal lobe in part of brain. Auditory nerve goes.
हाँ.
Okay. So, but cochlea is involved. Cochlea or
Cochlear nerve is called also auditory nerve.
no sir
yes, sir. तैया पूछ.
from cochlea to brainstem and then out from temporal is it sequence or path
हाँ.
so then how it is from main part is temporal it's brainstem
Okay. मैं एक्चुअली वही आप लोगों को समझा रहा था. ये रिसेप्टर्स है आपके. दिस इज अ रिसेप्टर. ओके. First, you understand the simple mechanism of sensory system. Okay, the receptor goes with the nerve. Okay, understand? And
जी
then
sir.
here it
Yes,
forms this sensory ganglia. Okay, from sensory ganglion it goes to the spinal cord, and in spinal cord it forms tract, and in tract it dissociates in the opposite direction immediately in the spinal cord or in the medulla oblongata. It goes to the opposite direction, and there it goes into the thalamus. Okay, and then from thalamus it goes to the different cortex. अभी समझ में आ रहा है? रिसेप्टर से नर्व से सेंसरी गैंग्लियन से स्पाइनल कॉर्ड. ओके, इधर इसको रिसेप्टर, ये नर्व, सेंसरी गैंग्लियन, स्पाइनल कॉर्ड से मेडुला से थैलामस से कॉर्टेक्स. सीक्वेंस समझ में आ रहा है? आपका सेंसरी सिस्टम कैसे वर्क कर रहा है, सेंसेशन कैसे जा रहा है.
जी
यस
सर.
सर
अभी अब ऑडिटरी को पकड़ते इसमें. तो ऑडिटरी हेयर सेल, जो ऑडिटरी रिसेप्टर्स है, दिस आर कॉल्ड हेयर सेल्स, क्योंकि उनके पास स्मॉल स्मॉल हेयर्स होते हैं, उसके मोमेंट वो सेंस करते हैं. सो दिस आर हेयर सेल्स. हेयर सेल्स आपका ऑडिटरी रिसेप्टर्स है, जो जब भी अभी मैं आवाज में बोल रहा हूँ, आवाज साउंड वेव के हिसाब से निकल रही है आपके मोबाइल के स्पीकर में से या लैपटॉप के स्पीकर में से, एंड दोज वेव्स मूविंग एंड गोज टू योर ईयर्स में टिम्पैनिक मेम्ब्रेन है, वो वाइब्रेट हो गई. That vibration goes and transmitted into auditory bones, that is uncus, hamate, and stapes, and causes a movement of the stapes. Now stapes movement has been amplified because tympanic memory बहुत कम होती है, उससे ज़्यादा stapes की movement होती है. Stapes is usually has a window on the bony cochlea. Bony cochlea के अंदर fluid होता है, उसको बोलते हैं lymph, endolymph, and that causes a movement in the endolymph. जैसे अभी ये पानी है, पानी को हिलाया तो मूवमेंट हो रही पानी की.
यस सर
Yes, sir.
एंडोलिम्फ में मूवमेंट होते हैं, बट एंडोलिम्फ इज नॉट इतना पानी की तरह पतला नहीं होता. इट इज मोर विस्कस इन नेचर, एंड दैट कॉजेज मूवमेंट ऑफ द एंडोलिम्फ, एंड दैट एंडोलिम्फ के ऊपर लगा होता है एक मेम्ब्रेन, कॉक्लियर मेम्ब्रेन, एंड दैट कॉजेज द मूवमेंट ऑफ द कॉक्लियर मेम्ब्रेन. अब उस कॉक्लिया पे हेयर सेल्स लगे होते हैं. और हेयर सेल जब भी कॉक्लिया मूव होगा तो हेयर सेल बेंड होंगे या स्ट्रेच होंगे। इफ अगर बेंड होते हैं तो सोडियम चैनल्स खुलेंगे, अगर स्ट्रेच होते हैं तो पोटेशियम चैनल्स खुलेंगे। बेंड हो रहे तो मेम्ब्रेन पोटेंशियल बढ़ रहा है, गोज टुवर्ड्स डीपोलराइजेशन। अगर स्ट्रेच हो रहा है तो मेम्ब्रेन पोटेंशियल नीचे जा रहा है। दिस इज हाउ इट कैन आइदर causes excitatory membrane potential or inhibitory membrane potential in the hair cells. So कुछ हेयर सेल्स में एक्साइटेटरी होगा, कुछ हेयर सेल्स में इनहिबिटरी होगा, और डिपेंड अपॉन दैट इट विल जनरेट एक्शन पोटेंशियल इन पर्टिकुलर हेयर सेल्स। एक बार एक्शन पोटेंशियल जनरेट हो गया, दैट एक्शन पोटेंशियल विल गोज अलोंग द कॉक्लियर न्यूक्लिया एंड गोज इनटू द 8th cranial nerve nuclei, which is usually present in the medullas. Okay, वहां से कॉक्लियर न्यूक्लियस से जो जाएगा, जैसे स्पाइनल कॉर्ड में सेंसरी गैंग्लियन होता है, क्रेनियल नर्व्स में न्यूक्लिया होता है, and from this nuclei it goes to the thalamus in medial geniculate body. It is one of the nucleus present in the thalamus. Okay, and from there it goes to the auditory cortex. समझ में आ रहा है?
Yes.
जी सर।
तो सारे सेंसेशन इसी तरह से जाते हैं, बट देयर आर डिफरेंट ऑर्गन्स इन्वॉल्व। कंसीडर आई। अब आई में क्या होगा? इंस्टेड ऑफ हेयर सेल्स देयर विल बी instead of hair cell there will be rods and cones. So light उसमें गिर रहा है rods and cones में, that make the chemical reaction, rhodopsin pigments depigmentize हो गया, उसकी वजह से potassium channels open हो गए, that causes hyperpolarization. That hyperpolarization goes to the ganglion cells, and ganglion cells now get normally it keep on inhibiting, but as it causes inhibition of the rods and cones, that will causes excitation of the ganglion cells and create action potential in the ganglion cells, and then it goes action potential goes to the optic nerve. So optic nerve में गया, from optic nerve it goes towards the optic chiasma, and then here from optic chiasma it goes to the Edinger Westphal nucleus. From there it goes to the thalamus, that is lateral geniculate body, and from the lateral geniculate body it goes to the visual cortex. These are the sensation carries. Now through this path only one sensation is exception, and that is olfactory sensation. Olfactory sensation olfactory mucosa में feel होता है, and it goes to the olfactory nerve. Olfactory nerve goes directly to the olfactory bulb, and from olfactory bulb it goes to the olfactory cortex, that is usually in the frontal lobe. This sensation doesn't go to the thalamus. Only olfactory sensation है वो thalamus में नहीं जाता, it directly goes to the olfactory cortex, while all other sensation goes through the thalamus. Okay, so most important part of sensory system is first receptors. They receive the signal, convert it into action potential, and then it carries to the through the nerves. So next part is the sensory nerve, and then from sensory nerve it goes to the sensory ganglia. Either it is spinal cord, it is called sensory ganglia, or in a brain for cranial nerves it is called cranial nucleus. From there it goes to the medulla, or it usually goes to the opposite side. Either in the spinal cord it goes to the opposite side, or in the medulla it goes to the opposite side, and then they goes to the opposite part of the thalamus. So thalamus right side के sensation left thalamus में जाएंगे, और left side के sensation right thalamus में जाएंगे, and then in thalamus it modified, relayed, or all those things, and then from thalamus it goes to the sensory cortex. This is how our sensory system work. But thalamus is not only the part which is a sensory, but other functions also perform. So, but it is one of the major function is sensory functions. Now, इसमें से हमने tract जो sensory ganglia से medulla तक जाता है, tract we already talked in spinal cord. Receptors practice session में practice classes में भी हो जाएगा. Now we'll talk about the thalamus, and if we get time, then we can talk about the cortex. Okay. Here we'll not go for individual sensation कि ये हर sensation का pathway कैसा जा रहा है, क्या जा रहा है, But here we'll talk more about it, generalize how thalamus works and what are the different parts of the thalamus involved in different functions. And that is good for your exam point of view also, so that if you get a question directly on the thalamus, you could able to answer it. ठीक है?
जी सर.
Now, once it reaches the thalamus process and all those things, and we'll try to understand how thalamus works. So before understanding the thalamus functioning and all those things, we should know the how thalamus look like, or what is the structure, or what is the anatomy of the thalamus. Here we'll just describe briefly, we'll not go in detail. Thalamus is usually a group of multiple nuclei which are placed together, and they present immediately close to the third ventricle. So they are actually in the below the second or we can go below the lateral ventricles, and lateral to the third ventricle. So ऐसे lateral ventricles होते हैं here, इनके नीचे, और यहाँ पे third ventricle होता है. तो these are somewhere light here. So it is just below the superiorly there is a lateral ventricles, while medially there is a third ventricle. So anatomical point of view, we can say that thalamus has a two ends or two poles, anterior poles, which is usually formed by the lie just behind the interventricular foramina. This is that interventricular foramina. Just उसके पीछे thalamus lies करता है. This is thalamic portion. Then our posterior end, if you see, it is just above and end as a pavilunar nucleus, which we cannot see here in this diagram. And there are four surfaces. Superior surface, which is usually from the central part of the lateral ventricle, at the floor of the lateral ventricle का, as a lateral ventricle के नीचे होता है. So superior surface is formed by the floor of the lateral ventricle, and it is more of the convex in structure. Then come to the inferior surface. It is usually present just above. This is a hypothalamus portion. So it is just above the hypothalamus, and also posteriorly also little bit of hypothalamus is present. Then come to the medial surface. It is usually formed by the third ventricle and also lined by the structure called ependyma. The medial surface also has a separate the two thalamus separately, and they are connected to each other through the interthalamic adhesion. So this is interthalamic adhesion where two thalamus are connected to each other and has a communication between the both thalamus, right thalamus and left thalamus, for the proper coordination of the sensation. And inferior portion of the medial surface usually has a hypothalamus, and that will produce hypothalamic sulcus. So this hypothalamic sulcus will separate the thalamus from the hypothalamus. Then come to the lateral surface. It is usually related to the posterior limb of the internal capsule, and it separates that internal capsule or the area through which the maximum tracts, sensory and motor tracts, goes through this internal capsule. Then come to the thalamic structure. As I said, it is a group of the nucleus, so it contains lots of gray matter. But along the gray matter, it also contains white matter. And white matter means the axons, while gray matter means the soma. So white matter is contained with stratum zonale, uh, which is from a thin layer matter which covering the superior surface of the thalamus somewhere here, while there is another external medullary lamina. This separates the reticular formation from the thalamus, and it usually contains thalamocortical and corticothalamic fibers. And then another is the internal medullary lamina, which is Y-shaped, uh, which separates the thalamus into a different group of the nucleus, and it is usually related to more interthalamic connections. Then come to the gray matters. Because of the Y shape of the internal medullary lamina, it divided into three portions: anterior, lateral, and medial portion. So this is anterior, this is lateral, and this is medial portion. Now come to the anterior portion. Anterior group of nucleus is made up of one nucleus, that is anterior nucleus. The lateral group of nucleus are made up of the two port again divided into two groups, ventral and dorsal group. So as it is a very big group, so lateral group, this is a ventral group and this is the dorsal. So this is a ventral group and this is a dorsal group. Ventral group forms ventroanterior group, ventrolateral group, ventroposterolateral and posterior medial group. So this forms uh, all ventral group. Then it also forms the medial lateral geniculate body and medial geniculate uh, bodies. Then come to the dorsal group. Dorsal group is formed by the lateral dorsal nucleus, uh, lateral posterior nucleus, and pavillonary nucleus. Then come to the medial group of the nucleus. These are majorly from the three group of nucleus. Large group is the dorsomedial nucleus, then a centromedial nucleus, and a thin line of nucleus, that is midline nuclei. Then come to the functional classification. Depend upon their functional type, this nucleus can be divided into non-specific projection nuclei and specific projection nuclei. Out of this, midline and centromedian are non-specific, and there has a communication with the almost all part of the body, including reticular activity system. And these are responses are very diffuse type of the responses. So on stimulation of this nucleus, you will not get any specific type of response. Diffuse, almost various part of the brain will be response when you stimulate this nucleus. Then come to specific. They are related to specific functions. A specific projection nucleus. So first is the sensory nucleus, the specific sensory relay nucleus. So the medial geniculate body, lateral geniculate body, and posterior ventral nuclei. Then come to the motor nucleus or motor control nucleus. These are usually formed by the ventrolateral and ventro-anterior nuclei. Then visceral nucleus are there, but anterior nucleus and dorsomedial nucleus, which participate in ventral visceral functions, and usually they are related to hypothalamus also for autonomic nervous system. Then integrative or perceptual function, which is has interrelated different relationship within the thalamus, and that is pavillonary nucleus, lateral posterior nucleus, and dorsolateral nucleus. Now, just naming this nucleus is not enough. To understand the functioning, we should understand the different connections, how these nucleus are connected to each other and how they are connected to the rest of the brain. So the connections are very important. This diagrams will gives you fibers which coming towards the sorry fibers which coming from the thalamus and fibers which coming to the thalamus. So as a we said, we are divided both non-specific nucleus and specific nucleus. First, we'll talk about a non-specific nucleus, that is centro median nucleus, or interlaminar nucleus, and midline nucleus. These are usually non-specific projection, and they send their projection to the different part of the cells and almost to the reticular activity system. Then they actually receives from reticular activity system, from basal ganglia and also thalamic nuclei, and they send fibers to the almost entire neocortex. जो पूरा जो cortex है, and also to the stratum fibers, it sends to the almost each and every part of the cortex, and they are more related to emotions, analysis, memory, and all, and also forms a part of the limbic system. Then come to specific projections. These, as we know, the specific sensory relay nucleus, they will send to the specific portions, like medial geniculate bodies receives the information from the lateral hemisphere, that is comes from the um, uh, cochlear nucleus, and then it project out to the auditory cortex. Similarly, lateral geniculate body receives impulses from the optic tract, and then it goes to the visual cortex. Then come to the motor nucleus, that is usually ventrolateral nucleus. It receives the fibers from the cerebellum and also from the basal ganglia, and it sends projection outside to the primary motor cortex, while ventroanterior receives fibers from the globus pallidus and substantia nigra, and it sends output to the premotor cortex. Then come to the visceral afferent nucleus. Uh, This antenucleus, it receives the input from the mammillary body and sends output to the cingulate cortex, while dorso-medial nucleus and has a strong to and fro connection with the both hypothalamic nucleus and also prefrontal cortex. Then come to the integrative perceptual nucleus, which has an interrelationship with like a pavillary nucleus will receive the input from the superior and inferior colliculus and send output to the parietal, occipital, and temporal lobe, while lateral posterior uh, ventroposterolateral nucleus and all those things they receives from the spinal medial trigeminal nerves and sends to the sensory cortex. So these are different part of the brain they will send. Then come to the dorsolateral nucleus, they receive it from the superior and inferior colliculus and send it to the different part of the cortex. Now we'll see the detail afferent different of this nucleus and how they are projected. So first come to the medial geniculate body. Before going ahead, we'll take a 2 minutes break and then we'll start. Okay, so now we'll talk a little bit detail about this each nucleus. So first we'll talk about medial geniculate body. Medial geniculate body. It receives the afferent from the lateral lemniscus and also from the inferior colliculi, which receives the fibers from the cochlear nerve, that is auditory sensations, and it projects them in a laminar fashion. So more organized, जैसे cochlear member के from one side it will come, it in the same arrange, this fiber will arrange and in same style it project in medial geniculate body, and then from medial geniculate body it analyze and make modified, and then from medial geniculate body it project to the auditory cortex in same manner, in same projection and same topographical arrangement. Then come to lateral geniculate body. It receives the sensation from the retina through the optic tract and also receives from the superior collicula, and it receives a huge number of the fibers from the retina, and the lateral geniculate body receives fibers from the temporal retina of the same side, while fibers from the nasal retina of the opposite eyes. तो अगर लेफ्ट साइड के हम lateral geniculate body की बात कर रहे हैं, it will receive the temporal fibers from the left eye while nasal fibers from the right eye, and that will represent in a topographical manner properly arranged, and out of these macular fibers they almost contributed 2/3 of the total lateral geniculate body, and that is also in the caudal portion of the geniculate body. The major representation is from the macula, while the rest of the retina will have only 1/3, and that is also in rostral portion. And from lateral geniculate body, in same topographical manner, it will release into the occipital cortex as in the form of optic radiation. Then come to the ventroposterior nucleus. That ventroposterior nucleus is receives the fibers. Uh, Ventroposterior nucleus reduces the fibers from the spinal, medial, and trigeminal lemniscus, and from there it receives the sensation like a normal touch sensation, general sensation, and also a taste sensation from the tongue, and then trigeminal fibers usually receive to medial, while the rest of the body will receive to the lateral nucleus, and from there it goes to the sensory cortex, area number 1, 2, 3, and 4, through the posterior limb of the internal capsule. Then come to the lateral nucleus, which is more of related to motor nuclei, and it receives the fibers from the cerebellum, that is dentothalamic fibers, and also fibers from the basal ganglia, specifically through the globus pallidus nucleus, and from there it analyzes, it sends the motor impulses to the primary motor cortex, that is area 4 and 6. while anterior nucleus, it receives the fibers from the basal ganglia from two nucleus, substantia nigra and globus pallidus, and from there it goes to the premotor cortex, and that is usually responsible for the coordination between basal ganglia, cerebellum, and motor cortex, and helpful for the maintenance of the body movement or posture. Then come to the visceral nucleus. So that first is the anterior nucleus, and this anterior nucleus is receives fiber from the mammillary body and forms the part of the Pepys circuit, and it sends fibers to cingulate cortex that complete the circuit, and it directly related to the hippocampus, and that's why it is more of related to the emotions, memories, and other parts. Then come to the dorsomedial nucleus. It forms 2 and 4 connection with the prefrontal cortex and hypothalamic nucleus, and this is also related to the analysis, memories, emotion, judgment, thinking. All those functions is related to this dorsomedial nucleus. Then come to the integrative or perceptual functions. These are formed by the three major nuclei: the pavilion nucleus, lateral posterior nucleus, and dorsolateral nucleus. So pavilion nucleus is from three portions: medial, lateral, and inferior portion, and they receive the fibers from the retina, superior colliculus, and perceptual areas, and they send fibers to the occipital lobe, temporal lobe, and also prefrontal and orbitofrontal lobes, and these are more related to the auditory and visual perceptions, and also visual reflexes. Then come to the lateral-posterior nucleus. It receives the fibers from superior colliculus and perceptual areas and sends fibers to the parietal lobe, parahippocampal gyrus, and cingulate gyrus. Then come to the dorsolateral nucleus. It also receives fibers from the superior colliculus and sends projection to the parietal lobe, parahippocampus, and cingulate gyrus. Then come to the functions of the thalamus. As I said, thalamus has a very important role in sensory functions. So it forms one of the most important sensory relay centers. It receives the impulses from the all sensory fibers except olfactory sensations. Olfactory sensations directly projected to the olfactory bulb, and from there it projects to the olfactory cortex. That is usually in a prefrontal lobe. While all other sensations are goes to the thalamus, and from thalamus through the thalamic radiations project to the sensory cortex or their respective cortex like auditory cortex or visual cortex, and that's why thalamus is also considered as a head ganglion of all sensory system. Then apart from the just it not just relay कि यहाँ से लिया और उसको दिया, it is not that simple. It also integrate the different type of the sensation. Like suppose you are have very emotional, then even light touch can also you'll feel respond like a pain or other type. So different type of the sensation are process integrated with each other, and then it project to the cortex. So it can increase the intensity, can decrease the intensity, it can increase the nature also of the sensation, and then it project to the cerebral cortex. Okay. Not only it project to the cerebral cortex, but it can also act as a receiving part of the brain. So it can perceive the sensation. So sensation perception can also occur at the thalamus level, but the perception is a very crude nature. That if there is no, suppose there is no cortex, or you remove the connection between thalamus and cortex, then thalamus can feel the sensation. Suppose we consider pain sensation, thalamus can feel the pain, but it will be very difficult to understand the quality of the pain. What type of the pain? Now, if you see, so pain में क्या quality होती है, तो now there are different type of the pains like colic pain, thrombolic pain, then a dull aching pain, or pricking pain, or stabbing pain, or crushing pain, or ischemic pain. So there are different type of the quality of the pain, but that quality will not understand by the thalamus. Apart from that, also will not able to localize exactly कहाँ पे pain हो रहा है, and detailing of the sensation will not be felt by the thalamus. Okay, but it can understand the nature of the sensation, that is, whether it is a sensation of pleasant or sensation of unpleasant, whether you, you agree with those sensation or you disagree with this sensation. All those can be felt by the thalamus. Then another important function of thalamus is integrates the various motor functions. It receives the impulse from the basal ganglia, it receives the impulse from the cerebellum, and also it sends the impulses to the motor cortex and integrate the basal ganglia, cerebellum, and motor cortex, and help us in coordination of the voluntary movement. Apart from this, it also help to regulate the muscle tone. Then come to its role with the reticular activity system. Thalamus is very important for arousal and alertness. So जैसे आप देखें, आप सो रहे हो तो आप अलार्म बज के उठ जाते हो. That is sensory input which comes, and because of it stimulates the thalamus, that's why it activates reticular activating system and you get aroused. Similarly, pain sensation can also arouse you from the sleep and all those things. So it is occurred through the thalamus. So thalamus is involved in activation of the reticular activating system and can cause for alertness or wakefulness. Then thalamus is also associated with the emotions. So whatever sensations coming to thalamus will relate to the limbic system, hypothalamus, and can produce various emotions and can form various emotions. And it also participate in formation of recent memory. Then thalamus is also involved in formation of the language and speech. Whatever auditory functions comes, it goes received by thalamus and then goes to temporal lobe, but it modified and integrated with other emotions, and then it goes to the thalamus. So it will able to understand the speech. So thalamus is also plays very important role in a speech portion. Then it synchronizes the EEG. It is more of the technical part. Now, whenever you record the EEG, the wave is very unsynchronous if you are awake. But when you sleep, it get synchronized. That synchronization occur because of thalamus, because thalamus will send continuous impulse, and that impulse will spread on the whole cortex, and that will create a synchronized EEG wave formation. Then it also integrate the various visceral and somatic functions. So whenever there is any sensation is received from the somatic part, then it can generate autonomic sensation also, and integrated response can be generated. Suppose now you have a somatic sensation, like you got a pain. Suppose there is an injury to your finger or something occur and you get a severe pain, then it is usually associated with the autonomic responses like increase in blood pressure, increase in heart rate, increase in sweating, all those increase in sympathetic activity overall can be there. And similarly, when you get a visceral sensations like a visceral pain or anything, then also you will see the autonomic responses and also somatic response. Autonomic responses like increase in salivation, increase in GI secretions, decrease in bowel movement, all those things you can see. Apart from this, there will be like if there's pain in abdomen, then curling on the somatic response, like curling on the bed, or if inflammatory pain, then you'll keep studying, will not move the body. All those responses these occur through the thalamus. Then thalamus is also important for the realization of the sexual sensation, perception of the sexual sensation. To realize the sexual sensation, you don't need a cerebral cortex. Even at the thalamic level also, you can perceive the sexual sensation. And then thalamus is also from the center of the various reflexes like writing reflex or withdrawal reflexes. All those can form through the thalamus nucleus. Then come to the applied aspect. In applied aspect, there is only one disease we can discuss. Here is a thalamic syndrome. Thalamic syndrome is usually produced because of damage to the posterolateral or posteroventral nucleus, and this is usually because of damage to the or blockage to the Geniculate branch of the posterior cerebral artery, which is one of the common type of the stroke, and it is usually a thrombotic stroke. Once the stroke is developed, it develops different types of sensations, and we can divide it into sensory and motor and other sensations. So first we see what are the sensory abnormalities can occur. So first thing, as I said, it prevent the connection between the thalamus and cortex. So cortical sensations completely lost. What will be cortical sensation? Cortical sensation which cannot be perceived without cortex. So these are the like a tactile localization, tactile discrimination, and stereognosis. All these three sensations will be lost, and this is called in toto called astereognosis. So what is tactile localization? Suppose I touch here, so even if I'll close my eyes, then also I can feel that finger has been touched this portion of the cheek. Okay, this localization will be lost. Second is a tactile discrimination. That is a if you with a compass you touch some portion of the skin, you will feel that whether you are touched by the one point or 2 point. That discrimination is also lost in thalamic syndrome. And stereognosis is identifying the familiar object with closed eyes. So this I'm holding this mobile. So even if closed eyes, I will feel that this is a mobile. That sensation is called stereognosis, and that is also a cortical function. So these all three functions has been lost in thalamic syndrome. Then come to the phantom limb, thalamic phantom limb. It is very important to understand the thalamic phantom limb. There are another term which is called phantom limb, and that is usually associated with amputation. So, what is mean amputation? Suppose some disease occurred to my hand, and this hand has been cut from this body to save my life, and there will be a stump will be formed, and here like this, and it will be kept there. Now, when the stump is formed, everything is cut, but the nerves which carrying this sensation from the finger and rest of the arm will be at the stump, and they will be exposed to the external external environment. So whenever those nerves get stimulated, so I will not feel sensation at the stump, but I will feel sensation where the actual receptors were presented. So if there is some pain is occurring here, I will not feel pain here. I will feel pain somewhere here in the finger which is not existing, and that is called phantom limb. But a thalamic phantom limb is totally different. So don't get confused with the proper phantom limb and thalamic phantom limb. In that phantom limbs occur because of law of projection. So what does law of projection say? Throughout the course, जो sensory system का मैंने course बताया कि receptor, nerve, then tract, then goes to the thalamus, and then it goes to the cortex. Throughout the course, if you stimulate any portion of the nerve or tract, you feel the sensation, but sensation you will not feel the where it's stimulated. Sensation you feel where actually receptor is present. That is what law of projection. Because of that law of projection, you will feel even if after amputation also, person will keep on feeling that hand is existing. Now come to thalamic phantom limb. It is like you had arm. Now वहाँ पे हाथ नहीं था. Still you feel there is a arm. But here because of damage occurred to the proprioceptive sensation, you had a arm, but you will not able to feel where exactly located. अगर आप पेशेंट की आंख क्लोज करवाओगे, उसका हाथ हवा में कहीं पे पकड़ लोगे, उसे बोलोगे दूसरे हाथ से छू के बताओ कहाँ पे, you will not able to identify where exactly his arm is located, and that is called phantom limb, unable to locate the position of his arm with closed eyes. This is because of decrease or loss of proprioceptive receptors, the kinesthetic sensation. Then third symptom is a thalamic overreaction. It is because of since the cortical sensation has been lost, now thalamus is receiving sensation will not able to integrate, and it will even as small amount of the sensation also will be perceived as exaggerated. So small pain will perceive as a very severe pain. So it is exaggerated, and very unpleasant, disagreeable sensations will be produced because of regeneration when occurring, that will cause hypersensitivity of the thalamus. Then come to the motor part involvement. It produces the ataxia because of as you will not able to sense the positions, the proprioceptive sensation is not there, and also causes cerebellar fibers damage. It will develop ataxia, that you will not able to understand your movements, which surveillance will not go, and so you will keep on saving on the either side, or you can fall when you close the eyes. That is what ataxia is there. Then there will be involuntary movement. That is because of either involve of the globus pallidus can cause chorea, which we already discussed. But again, I will tell you, chorea is a rapid jerky movements of the small joints, so fingers and wrist joint will be involved, while athetosis is usually slow and wavy type of the movement. So that both type of the movement can occur, but not simultaneously. Either it can be chorea or athetosis. Similarly, there will be the intentional tremor. Parkinsonism में resting tremor होता है. So tremor when you are not doing any actions, and moment you perform, you try to perform an action, that tremor will be lost. But here opposite, when you are at rest, there will be no tremor. Moment you try to do any action, there will be tremor will be generated, and the tremor will keep on increasing when you reach to the target organ. So there will be intentional tremor. Then there will be a thalamic hand or atheroid hand, where abnormal position of the hand will be occur, and here will be a moderate flexion of the wrist joint and hyper extension of the finger. So this type of the position of the hand will be there. That you can. It is one of the diagnostic feature of thalamic syndrome. So that's all about the thalamus. Any questions? Any doubt? Any questions? Any doubt?
No,
No, sir.